So good early afternoon, morning. My name is Deanna. I am a social worker on the Substance Use Disorder Center of Excellence team at Rush in the Department of Psychiatry and Behavioral Sciences. And I will be doing a presentation on the substance use disorder treatment and adolescence. So this presentation will be geared more towards adolescents only, no adults or anything of that sort. So our learning objectives today, we want to establish a baseline of understanding the medical model of substance use disorder. We want to discuss unique challenges for treating youth adolescents with substance use disorder. We want to learn what treatment models have been used and the most effective treatment options. And we want to understand how to give adolescents agency in their treatment plan. So some myths and stigmas around substance use disorder is it's a choice, it's a moral failing, they want to be that way, they are bad people, they are junkies, survival of the fittest, they are criminals, it could never happen to me. And other stigmas are they don't really want help, it is easy to get treatment, they should just stop. It's all about willpower. If they didn't want to live like that, they wouldn't. If you have an opioid use disorder, you can't have pain. And always is medicated assisted treatment enabled substance use, and Narcan enabled substance use. This is from a former governor who said, "Why revive them when they'll just use again?" And this is not the first time I've read this. This is not the first time I personally have heard this. I've heard this from officers and people that you just shouldn't hear these kind of things from when you're a service focused career. So some facts about substance use disorder. Sorry. Oh my goodness. Substance use disorder is among the most stigmatized condition in the US and around the world. Healthcare providers might treat patients as clients with substance use disorder differently due to stigmas. People with substance use disorders who expect or experience stigma have poor health care outcomes, which in this case, they don't typically want to go to the doctors or clinics or seek any help because they're so used to being treated badly and they just feel like, why am I going to get help when I'm just going to be treated as if I'm not a human? And so according to the World Health Organization, about 75% of health inequalities or differences in outcomes can be considered unfair and potentially avoidable, and as a result are labeled as health inequities. So modern chronic disease model. So the goal is lifelong management for any chronic disease management and recovery management. So disease severity may change over time, but risk of symptoms reoccurrence is always present. So effective treatment often combines with medications, counselors, peer and recovery support. And behavior change is a key part of management. Behavior change occurs in stages over time. So it's not something that just happens overnight. These are things that have to be worked on in order to do a complete recovery. So substance use disorder current definition. According to the American Society of Addiction Medicine, substance use disorder is a complex chronic disease of the brain, reward, motivation, memory, and related circuitry. A chronic relapsing disease characterized by compulsive drug seeking and use despite harmful consequences as well as changes in the brain. And the DSM of brain disease whose symptoms are overwhelming cravings and resultant behaviors. So now they're looking to do vaccines in the future to prevent dependence and tolerance to drugs, but that's something that's still being worked on. So why do some people develop substance use disorder while others don't? And we all know that genetics play a big role in substance use disorder. The genders, men are more susceptible than women to use drugs, and mental disorders make you more susceptible to substance use disorder. Also, the environment, chaotic home and abuse, your parents' use and attitudes, peer influences, social media, community attitudes, and low academic achievements are all things that contribute to substance use disorder and the brain function and how addiction starts. So with this craving meter, it's just showing that the craving for food in any human is the size of a baseball. And then the craving for water in humans is the size of a basketball. But the craving for drugs is the size of a baseball field. And if you've ever been to a baseball field and know you can go from craving food from being the size of a baseball to a basketball, and then a baseball field craving for drugs, then most people will understand why substance use is an addiction. Risk factors of developing substance use. Having another mental health condition increases your risk by 3 to 6 fold. Adverse childhood event score, your ACEs scores, contribute to if an adolescent will be addicted to substance use. Using drugs before the age of 14 makes a greater risk of developing a substance use disorder. Teens with high levels of perceived neighborhood disorganization had 2.6 times odds of a diagnosis of substance use disorder. Peer influences and attitudes. We have school, clubs, community peers, and as well as social media all play a part. And drug characteristics are short-acting, potent, injected, smoked, or snorted, hypertension, and diabetes in substance use. So some signs and signals to look out for with adolescent substance use is losing interest in activities they once enjoyed. Maybe they were on sports for all of these years or cheerleading, and all of a sudden they just don't show interest. They drop out. They don't want to do it no more. They don't want to hang around those peers anymore. And then they start hanging with new peers. So dropping old friends for a new group of people who probably engage in the same type of activities that they are currently engaging in, acting despondent, aggressive, or angry, sleeping more than usual, breaking the rules, not coming in at curfew, not checking in, not letting people know where they're at or saying where they're supposed to be, but not actually being there. Exhibiting physical changes like sudden weight loss, frequent nosebleeds, bloody or watery eyes, or shakes and tremors. So now we'll move on to THC in adolescence and brain development. It is increased risk below if using THC products before the age of 25. So adolescents will have difficulty thinking and problem solving, problems with memory and learning, reduced coordination, difficulty maintaining attention, and problems with school and social life. Opioid use in adolescents, is pretty important. Adolescents ages 12 to 17 years of age, and 7.3 of emerging adults ages 18 to 25 years used an opioid in the United States. Prescription opioids are the most commonly used in adolescents and youth, and increased risk of opioids in adolescents/youth also include being diagnosed with hepatitis C, having overdose, as well as HIV apathy. So according to this graph, so youths who had substance use disorder but did not have a major depressive episode were 900,000, and then 1.6 million youth had a substance use disorder, and out of that, 4.1 million youth had a major depressive episode, and then youth who had major depressive episode but no substance use disorder was 3.5 million. So opioid use in adolescents continue. Early drug use correlates with substance use problems later in life, and the most significant increase in destructive behavior appears to take place among older teens and young adults. And according to the Youth Risk Behavior Survey in 2019, 16.6% of Chicago high school students reported using a prescription pain medicine to get high one or more times in their life. So what are some treatment challenges for substance use disorder in adolescents? There's limited research available on adolescent substance use. As the years come, there's more and more research and therapies that people are trying to put together, but research conducted to review best modality of treatment for adolescent substance use disorder treatment. So it was limited recommendations available based on the limited research. From limited results, adolescent with co-occurring externalizing pathology of others, or those higher in substance use disorder severity, more intensive treatment appears to be more effective. Other findings were often inconsistent with examining the sex or race and ethnicity. And then complications of dual diagnosis. Up to 60% of providers, adolescent clients with PTSD also had substance use disorder, and mixed perspectives on how to best treat adolescents with post-traumatic and substance use disorder. So substance use treatment in the era of COVID challenges. So because of COVID-19, many pre-existing factors for adolescent substance use. Challenges in providing care to adolescents through virtual platforms include limited lab monitoring, avoidance of treatment, and potential breaches in privacy. Treatment considerations should focus on adolescents who are most at risk of relapse or exacerbation of their use. More restrictive care may be necessary for some youth. So now we'll get into some treatments that are being used now. So as far as treatments, the medication is buprenorphine, naltrexone, methadone, naloxone, and medication for co-occurring psychiatric disorder, naloxone, also known as Narcan. Behavior therapy, we have motivational enhancement therapy, cognitive behavior therapy, and adolescent community reinforcement approach, as well as contingency management. So to monitor drug use, it's just a toxicology test, urine or saliva, and then medical treatment, assess and treat infectious diseases such as hepatitis, HIV, and STDs. Family involvement could be caregiver only, community reinforcement and family training, also family therapy, family behavioral therapy, functional family therapy, multidimensional family therapy, and multisystemic therapy. And community recovery support is mutual health organizations such as AA, NA, and Smart Recovery. We also have educational support and vocational support. So behavioral therapy treatment options. Individual treatment options include mindful-based substance abuse treatment, cognitive behavior therapy, motivational enhancement therapy, and contingency management. Peer treatment is alternative peer group, adolescent community reinforcement approach, and outpatient therapy. So some principles of motivation interviewing and the stages. So motivational interviewing is underpinned by a series of principles that emphasize a collaborative therapeutic relationship in which the autonomy of the patient is respected. Within motivational interviewing, the therapist is viewed as a facilitator rather than expert who adopts a non-confrontational approach to guide the patient towards change. The overall spirit of motivational interviewing has been described as collaborative, evocative, and honoring of patients' autonomy. So principle 1 is to express empathy. Principle 2 is to develop discrepancy. Principle 3 is to roll with resistance. And principle 4 is to support self-efficacy. So the confidence ruler for change and empowering adolescent clients to feel in charge of their treatment. The confidence ruler is great for ambivalent clients because it helps them express reasons to change and identify their best next steps to start planning for change. So it works like this. You want to ask the client on a scale of 1 to 10, how confident are you that you could make this change if you decided to? Ask, how come you were this and not that? So example, if a client answers 5, ask why she didn't say 3. This question almost always elicits change talk because it reveals why the client's confidence exceeds its doubts. On the other hand, asking why are you 3 and not 5 usually triggers sustained talk by revealing more doubt than confidence. And 3, you want to respond with a reflective statement. Now ask, what would it take for you to get from this to that? This process helps the client start to identify a change plan. So treatment options, family and community support, we have for parents is the NIDA toolkit that they can use from this website, community reinforcement and family training module, and family therapy. As far as community support, there are support/mutual aid organizations, 12-step programs, AA or NA, and then community educational support and youth vocational support. So community support can include programs like Familia Unidas, Strong African American Families, and Centers on Hosted. With Strong African Americans, you can actually, if you want people to be trained in it, can reach out to our section and we can sign you up because we are trained in SAFE, which is Strong African American Families. So treatment options, new care interventions, utilizing technology as a recovery resource. So research team developed an app with supportive youth to implement new recovery strategies. So they have educational modules used most frequently, the ABCs, which is activating events, beliefs, and consequences, decisional balance, identifying triggers, finding something new, planning for the future, and relaxation exercises. When giving agency to adolescents in treatment planning, you want to use motivational interviewing. You want to allow adolescents to voice their preferences in treatment and care, to build family safety plan together, to continue to use harm reduction principles, and to establish collaboration on building family boundaries. So giving agency to adolescents about prevention, we want to give them information. Preparation is always best. It is already within their community. Villainizing drug usage is and most times it's ineffective because it's a part of the society. Helping youth develop a positive coping method. You want to encourage emotional regulation. And you want to reduce stigma in order to provide a safe and non-judgmental place for youth to approach. So supporting parents with motivational interviewing tools. So first you want to ask permission. Can we talk about? You want to ask open questions. What do you think about? And then you want to ask closed questions. Would you want to? You want to tell education. We know that. Inform, most of the choices are, and give recommendations. You might want to. And then we want to listen, so appreciate. You know what you reflect, you want to, but, and then you want to summarize. So your plan is. So again, we want to meet the person where they are, whether they're a child, adolescent, adult. So it's important to understand that we often live in separate realities and worlds and come from different walks of life. We want to empower people to hear us and think through making changes when we listen and give them respect for their worldviews. And we want to communicate better when both people feel like they are understood in their present situation. Then we can work together to help a person decide to make changes that make a difference for their world. So how to get substance use help, there is an Illinois helpline that you can reach with the link. And then there's an adult line that you can call. And then there's also teen and pregnant individuals at Lawndale Christian Centers that can be reached at the 872 number. And so now I want to talk a little bit about harm reduction and some examples of harm reduction. We use harm reduction in everyday life with different things as far as sunscreen, seat belts, abiding by the speed limit, birth control, and cigarette filters. The defining features of harm reduction include a focus on prevention of harm rather than on the prevention of substance use itself. So harm reduction initiatives run the gamut from medical care and disease prevention to education and linkage to addiction treatment. So some examples of substance use harm reduction are patient-centered care, overdose prevention, fentanyl test strips, and readily available Narcan. So in conclusion, you just want to know the facts. Substance use disorder is a disease. There is treatment and recovery is possible, but you just got to keep in mind that there's not a one treatment fits all, and it will take some people more than one time to seek treatment and recovery before they're fully recovered. You want to be aware of signs and symptoms of substance use in youth and know that that differs from puberty symptoms. You want to choose your words carefully when confronting the issue and build collaboration between you and you. You want to use tenets of harm reduction. You want to educate others in your community. You want to build a supportive network to support and uplift you. You want to be supportive and include everyone. You want to replace misconceptions / fear-based language with evidence-based facts. And you want to offer compassionate support. And thank you for listening to our substance use and adolescence training today. Please take the time out to take our survey.